healthcare in the Palestinian territories. This is going to be hopefully an informational session today. My hope and our hope as a PAMA group is to educate and have an interactive session and to really focus and highlight on the disparities for women of Gaza. I think there's no one at this point left who's not aware of the disparities in healthcare in the current war and crisis. And the most important message that I really hope to bring today to everyone who's taken the time to join us is, how can we better improve the situation? How can we work together to collaborate and from a humanitarian aspect, ensure safe access and humanitarian access to the women, the children, and the people who need our help? So I'm very, very blessed today to be able to share with you some testimony from physicians in Gaza. I'm joined by two of our very recent mission team members who went to Palestine, to Gaza, and were part of the PAMA mission. I've got Maggie, who's one of our critical care nurses and has a master's in critical care and a background in ICU medicine. And I'm going to let her introduce herself shortly and tell us about her recent trip to Gaza and how she helped partake in probably one of the most life-changing missions for her, but also for the people of Gaza. Also, I'm joined with Dr. Jumana, who's one of our PAMA members, as a neurologist, who will share multiple areas that she wants to highlight today with our group to talk about both the psychiatric, the mental health, and the other implications of the work that she did in Gaza on the most recent trip, and hopefully going back again. So I want to start with some testimony. I think for me, the biggest thing as an OB-GYN, as a member of PAMA, but also as a member of the greater community of physicians, is I feel like women have a very special place in our world. We carry the babies, deliver the next generation of humans, and also partake in so many aspects of human life and humanity that we have to ensure safe access for care and for nutrition. And in my journey and in talking to some of the physicians in Gaza, I really, I learned that not only is the job very stressful to deliver babies and to ensure healthcare is safe and equitable for women, but also to protect our healthcare workers. And in order to partake in women's health, we have to really look at the global picture. So currently, there's over 1 million Palestinian women in Gaza who are displaced. There's greater than 50,000 pregnant women. Every month of approximately 6,000 deliveries that are happening in Gaza, we are going to hopefully expect to see about 1,000 cesarean births. And the conditions in which they're operating right now are really not safe. They're unsanitary. They're really nothing that any of us would tolerate for ourselves and for our family members. And one of the physicians I spoke to through the Ministry of Health in Gaza shared with me she'd been displaced to Rafah and then was relocated to the Deir Balah. And right now they're doing cesarean births in tents. She shared with me that she walks approximately a mile every day to get to her work. And they are not always provided safe sutures, safe sanitation, or even the tools that they need. Another one of the physicians I spoke to shared with me the fact that he has worked every single day since October without a single day off. And he himself has not had appropriate nutrition, not only from an aspect of healthcare worker mental stress, but that's something we'll highlight in the latter part of our webinar today, hopefully. But our mission to the patients and to the women, and also to those healthcare workers who provide them with care. And so he shared with me many aspects of healthcare that are changed. And I also was able to speak with the president of the Society for Obstetrics and Gynecology in the Palestinian territories. His name is Dr. Adwan Barouti, and he shared with me a lot of disparities in healthcare, from the lack of access to ultrasound. Ectopic pregnancy, for example, is something that we continue to see throughout the crisis. And we really don't have safe sanitary trocar placement for our laparoscopic surgeries in Gaza. In labor, some of the stories that they shared with me include the lack of access to ultrasound, and there are no glucose monitors. Glucometers are lacking. So for women with gestational diabetes, for women with hypertensive disease who need appropriate ultrasound follow-up, we really are not providing any of that care for them right now. And even the non-stress tests. So non-stress tests are the little tracing monitors, as many of you know, for labor management and to be able to ensure babies are safe during the process of labor. And unfortunately, in one of the hospitals, Al Nasser Hospital, where one of our colleagues from Indiana is currently volunteering, Dr. Thania, who I spoke with and actually have an audio that I might be able to share if my computer reboots itself, shared with me that they're down from 6 monitors in their labor and delivery unit to only 1 functional one to share amongst all the patients. Other things I do want you to take into consideration are the lack of access to blood products. Right now they have hemorrhages, of course, and labor. As we all know, women's health is one of the most critical aspects of healthcare, where we quickly go to critical when we have hemorrhage, when we have bleeding situations, and unfortunately, there's no parenteral iron infusions. And the reason I bring that one up is because obviously we want to provide women with great nutrition, which is lacking right now. We have no antenatal or postpartum or during pregnancy care, but importantly, there's a lot of anemia due to malnutrition. And then women come in to have their babies and they lose a lot of blood volume. And unfortunately, what's happening is as they lose blood, they don't have the right medications. They don't have a very life-saving device called the Bakri balloon, which we often have used for years for hemorrhage prevention and treatment. And they're even lacking blood products like fresh frozen plasma, cryotherapy, all the essential products that we need to ensure safe delivery and access for women. Other important things to mention: miscarriage. Of course, miscarriages continue to happen, and there's some quotes of up to 300% increase in the rate of miscarriage in Gaza. Now, a lot of that could be due to toxins, and it could be due to the environment, of course, in which women are in. But the sad part of it is we are seeing more miscarriages. We are also seeing more retained products of conception, which is a condition where women either have a miscarriage or a delivery, and then there's retained placental products, and there's no safe way to remove those. One of the physicians I spoke with told me that they lack the trocars, which are the plastic tools that we use for surgery when we do gynecology surgery. And unfortunately, they're literally washing them with saline and reusing them when they're supposed to be one-time use products. So from my standpoint, in hearing the testimony of these physicians, also what struck me a lot was the morbidity or the mortality rate in Gaza, actually compared to some European and other advanced countries, of about 25 per 100,000 prior to the current war. And now it's at least 4-fold increased. The access to in vitro fertilization, which many of us have been through or taken care of patients who have been through IVF. This is how we obviously help with infertility care. Not only has that been halted and stopped, but there has unfortunately been destruction of the one primary IVF lab in Gaza. There were over 4,000 embryos fully made and ready to be used in families to grow their children and their hopes. And unfortunately, all of those embryos and even frozen eggs were destroyed in the process. So without further highlighting the situation, I do want to introduce next my speaker, Maggie. Maggie and I had the pleasure of meeting when we went to Minnesota together, and I really feel like Maggie can share a lot of her own input and a lot of her experience with us today. Maggie, do you care to join in on the Zoom, please? I know you're with me.
Thank you, Maram. Thanks, everybody. It's nice to see everybody here. Thank you for joining us. I'm Maggie. I was on PAMA's second mission. So end of February, beginning of March, I was in Gaza. I also was part of the mission in May, but we weren't able to cross the border because of the closure of the Rafah crossing. So I was working at the European Hospital. It's one of the last remaining functional hospitals in Gaza. I do ER and ICU nursing. I was mostly in the ICU when I was there. I don't normally, as an adult ICU and ER nurse, I don't normally directly care for pregnant women or newborns unless, the pregnant woman is in the ICU. But definitely in my 2 weeks there, I spent a lot of time with the women, the doctors and nurses that I worked with. I spent hours, not just working with them, but talking with them. I asked them questions about what they had been through, their experiences. I heard their stories of everything that they had gone through and that they were still going through, the things that they were suffering from, what they were afraid of, all of those things. So today what I can share is just anecdotally what I saw and experienced, and also some of the stories that they have shared with me since I've returned home. I reached out to a few of my friends. They weren't able to join us today on the webinar, but I asked for their input. Do you have any, additional insight, things that I could share on your behalf of what the women in Gaza are facing? So I hope today that I can just be their voice, the voice for these incredible, courageous, resilient Palestinian women that I worked with and that I know and that I'm honored to be friends with, actually. So I hope that you can let like their strength and their beauty be the forefront of your mind as you also hear their stories of unimaginable pain and suffering and the insurmountable challenges. Hold both of those things at the same time. Both of them are true. So just a little context with the European hospital, it is functioning way over its normal capacity, as you can imagine. So there's, you know, when I was there, maybe 1,000 some patients for a hospital that was intended for around 200. In addition to that, there's thousands of people that are taking refuge at the hospital who are displaced. So inside the hospital, every bit of the hospital, every hallway and stairwell was just taken up with people trying to live and find shelter, as well as outside the hospital, makeshift tents and dwellings all around. So you can imagine the public health concerns that go along with that, a lack of sanitation, obviously, as we all know, the lack of clean water and food, the spread of communicable diseases. There was a lot of upper respiratory infections and gastrointestinal infections, and hepatitis has been an increasing problem for a long time, but more so with every day that passes. There were children that died from hepatitis while I was there, who had contracted it from poor sanitation, and we didn't have the medications to treat them. The hospital in the ICU, there was a complete lack of supplies, very basic supplies, so not even just high-tech equipment, but a lack of soap, hand sanitizer. Infection was rampant in the ICU. Everyone was getting infection. There was very poor infection control because we had to reuse equipment that is normally used for one person, and that's it. We were having to try to wash and reuse them. There wasn't linen for the beds. There wasn't a basic medication. So these patients were suffering the most excruciating wounds and injuries that you could imagine, and we were giving them Tylenol, essentially. The mortality is disproportionately high in the ICU, so basically everyone was dying. And when I say everyone, I want to point out that over half of the ICU was filled with children. So these were children under the age of 14, as young as 3 years old, with horrible crush injuries, explosive injuries, massive burns, wounds, traumatic brain injuries, sniper gunshot wounds to the head in children as young as 10 years old. I paint this picture to create some context and to show you the bigger picture of what women are trying to live and survive and work through every second of every day in Gaza. The women that I worked with, every single doctor and nurse that I worked with had been displaced from their homes multiple times. So all of them had lost their homes. They had been forced to evacuate once, twice, 3 times. Some of them had been forced to evacuate under very emergent situations. So I worked with many nurses who had fled from the north, who were in hospitals, Indonesia and Al-Shifa, who were under siege, and they evacuated to the south with just the pair of scrubs that they were wearing, that they continue to wear every single day. They wash on their off day in between, they sleep in them. That's literally all they evacuated with. They're still being emergently and forcibly evacuated. So I spoke with one of my friends. She's a nurse in the ICU, and a few weeks ago, her husband was at work. He's also a nurse in the ICU. And they were told that their building, the residential building that they had been displaced to for the 2nd or 3rd time, was going to be targeted by Israel, and that they needed to leave right now, essentially. So this friend of mine, she has a 1-year-old daughter. So she was alone with her 1-year-old daughter and a few other families. And she had to just, within like 5 minutes, try to evacuate this building. So I checked on her that day and I said, "Are you okay? How are you doing? What do you need? You know, how do you even ask someone, you know, how are you doing? You nearly just died with your 1-year-old." And she was frantic. She was terrified. She had tried to face this on her own while her husband was working. He's working and not knowing what's going on with her and their child. And she said, "I don't have any milk for my baby because I left it there because I was just so frantic to get out." So she left the diapers and the milk and some of the necessities that she needed that are very hard to come by, if not impossible to come by. And she's frantic, she's terrified, and her story is repeated 1,000 times. Another one of my friends, a nurse in the ICU, she was working at the Indonesian hospital when it was under siege. She was able to evacuate again with just the one pair of scrubs that she was wearing. She's a young nurse. She was separated from her family, who remains in the north. So she is by herself. She's scared. She's lonely. She's isolated. She's terrified. And her family, she has very limited contact with them because the telecommunications are, there's nothing. She can't reach them. She can't send money or food or anything. She knows that they're starving in the north. She knows that they're just barely surviving. And she's just still going to work every day and showing up and trying to do her best for the patients that she's caring for in the ICU. I have another friend who was an ICU nurse at the European hospital, and she was part of a medical evacuation of a patient to Egypt. So as part of she was the healthcare person that was accompanying the patient. And because her two young children were below a certain age, they were allowed to go with her for this medical evacuation. Well, when she got to Egypt, and then she was there for a little while with the patient, and she was going to make the very impossible decision to possibly stay in Egypt if she could maybe raise enough funds to, get her husband to evacuate. She left her husband and her family in Gaza. This was when the Rafah border crossing was open. So first of all, that's an impossible decision to make. She's got these two young children. She's alone in Egypt. She has very little money. She has no way to provide for herself. She's scared. She's living with people she doesn't know, just trying to protect herself and her children, trying to raise funds maybe so that she can get her husband to evacuate. Then the Rafah border closes. So even if she wanted to get back into Gaza, or if she wanted to get him out, there's no way that either of those things can happen. And now she's alone with her two children, just trying to survive and figure out what to do. And her story is also repeated 1,000 times. The displacement of these doctors and these nurses, these women who have these small young children who are trying to take care of their newborn babies that they gave birth to in the tent, and then they are trying to still care for them in the tent, trying to walk long distances to get water, to get food. Their babies are malnourished and they know it, but they can't find milk to give them. Then they have to leave them and go to work and just pray. They told me, we just pray every day while we're at work that we don't come home to find our baby has been killed by an airstrike in the tent. They hope at night and pray at night as they hold the baby and that they're not going to be killed by a bomb that night in their tent. So they're working, and I wouldn't even say their living conditions. I would say that their surviving conditions are such that it is a constant stress and pain and agony and horror and terror and frantic sort of every second of every day. Like the bombing doesn't stop. It's all day and all night while I was there. That continues. But the threat of the safety, even when they're at work, they're worried about their family that's back there, or when they're with their family, they're worried about, the husband that they're separated from or their family that they're separated from. There is no rest from this constant stress and pain. I just want to share a couple of things. One of the people that I reached out to, asking her for her perspective and her thoughts. She's just the most incredible woman. She Sohad Najer, I asked if I could share her name and she said yes, but she works at the Ministry of Health. She's worked there for 24 years. She has a nursing background. She's actually, before October 7th, before the destruction of every single university in Gaza, she was the nursing professor at 3 different universities. She told me the Palestine College of Nursing, Al-Aqsa University, and the University College of Applied Science. So this woman is very, very knowledgeable and amazing, and I respect her greatly. But some of her feedback to me was some of the things that we've talked about, some of the things that we intuitively would think about in terms of, pregnant women and their lack of nutrition and, all of these different things, and newborns and their lack of clothes, diapers, malnutrition, all of those things she mentioned. There's the things that we also think about, like lack of feminine hygiene products. When I went to Gaza, I came with a huge suitcase just full of feminine hygiene products and passed it out to the women who were taking refuge at the hospital and the doctors and nurses that I worked with to just try to help for maybe a couple weeks, you know, like not much that I can do, but I think the thing that she focused on the most that was the biggest concern to her out of all of these other things that we're talking about was the lack of stability for these women. A lot of these women worked before October 7th, and now they've lost their ability to have a job to provide income. The loss of their homes, of course, the loss of their husbands, which for many of them, the husband was their caretaker, their provider in terms of just the economic sort of stability. But the emotional distress caused by by this unimaginable pain and trauma that is persistent, the emotional distress and the psychological distress, the constant fear, the constant uncertainty, that was her biggest concern, and the things that she's seeing among the women that she knows and the nurses that she's working with. That was the thing that she is worried about the most about the women in Gaza. One other thing that one of my friends, the ICU nurse that is in Egypt right now, I reached out to her, asked for her feedback. Some of the things that she shared with me were a couple of things that I hadn't thought about was she was talking about her concern for her family members, the women in her family that have high blood pressure and they're not able to get their hypertensive medications. So, you know, these basic things that even if you can get to a health facility in Gaza, which is, you know, it may be impossible logistically because of the roads, or it's not safe, or there's just not any left around you. These people that have these chronic conditions like asthma or diabetes, hypertension, they're not being seen, because if you walk into the ER and you're walking and talking, you're not going to be seen. There's patients all over the ground. They're you know, over their max capacity with patients that have these traumatic injuries. There's no access to blood pressure medications. She's also talking about how women are cooking over fires more because there's a lack of cooking gas. And so people that have these asthma and these other kind of chronic conditions are having exacerbations, but they don't have the care that they need. They don't have the inhalers that they need. They don't have these sound like quote unquote simple things that actually could be life-threatening. My friend, the one who's sharing this, who's in Egypt, she is anemic, and we talk about anemia in terms of, you know, like pregnancy, but women just have higher rates of anemia in general. So she was so anemic when she got to Egypt. Luckily, she was able to actually go to a health facility, get her blood checked, find out she was anemic, and she required a blood transfusion because she was so anemic. So she was one of the lucky ones that was able to actually get tested because she had gotten out of Gaza. But for the women of Gaza, not even just the pregnant women, just women in general who might chronically be anemic, these issues are completely unaddressed, not addressed for them. One of the things that she talked about, which might be a simple thing compared to losing your life or the life of your child, but still cumulatively affects your psychological state, women are just losing their hair because of a lack of nutrition, and also combined with the psychological stress and trauma of what they're going through. Again, that's not life or death, but all of these things impact the general well-being and the overall health and mental health of these women and what they're facing. You know, I sat with these nurses, you know, who became like such dear friends who I still talk with. And I sat with them, and they just in the ICU, and they just told me, you know, we miss like little things like having water to wash our hair, or having shampoo to wash our hair, or having lotion to put on our hands, or something to wash our face, or, you know, and again, in the scheme of like losing your life or not, maybe that's not as big of a deal, but think about the things in our life that we take for granted, like that I can just easily go turn on my tap and get some water, like that I can just easily wash my hair and refresh myself. Like these people are experiencing this, these women are experiencing this, and yet they're coming and they are working and they are striving to just survive, to protect themselves, to protect their families, their kids. And you think about the burden of like not getting sick yourself. You think about the burden that women carry of, oh no, I need to keep myself healthy also so that I can care for all of these people that I'm responsible for. I worked with a nurse who came to the hospital. She's responsible for a young toddler. I think he was maybe the child of her sister. Anyway, she was responsible for him. She comes to work and she's jaundiced in her eyes and looks so sick. She has hepatitis. And now she's trying to take care of herself and make sure that she can keep herself healthy while also taking care of the others that she's responsible for. So I think, yeah, it's just layer upon layer of unimaginable suffering and challenges.
Thank you, Maggie. I think you highlighted a lot of real people stories. And I think that was one of our aims today, was not only to make this an educational experience, but a more interactive experience. And I hope and I pray that everyone feels what you feel and feels what you saw. You highlighted critical care, which is your background. And, as a clinician who takes care of high-risk pregnancy, I will say one of the things that I've worked on in my home state in Indiana was our maternal morbidity and mortality rates. And to think of how these women in Gaza are not only lacking access to prenatal care, but also preconception counseling, uncontrolled hypertension, diabetes. You mentioned worrying about being alive. Well, yeah, we worry about, is my baby growing? Is my baby getting to those milestones? Whereas I think in Gaza, the women are worrying about, am I going to live tomorrow? Am I going to live today? How am I going to feed my children? And I think those are all very valid and very, very important points to highlight to the world. The other important thing is eclampsia and preeclampsia, and that is critical care access. Not only are the hemorrhages and the preventing and treating very, very critical, but we now have women in Gaza who do have hypertensive disease with no access to growth and delivery parameters. And then what does a woman do when she goes into labor? All of the clinicians whom I spoke with, and one of them is a physician who is at least 20 years my senior, who trained in Europe and had lived in Dublin and in the United Kingdom. And he shared with me in his whole life as a clinician, as an obstetrician gynecologist, and as a specialist, he never ever thought he would see these kinds of things he's seeing and experiencing. He said it's worse than the medieval times. Women are coming by mule and by donkey if they can have reliable transportation. And he said they've had to do cesareans under local anesthesia with Tylenol and morphine and hold people down while they scream. And those are screams you cannot unhear. Another colleague of mine who currently is in Gaza said to me, she said that they had a twin pregnancy that had twin transfusion syndrome, which is something that we see often, unfortunately, with monochorionic twins or identical twins, and that we monitor for every 4 weeks at least in the United States. And this pregnancy past 20 weeks had to be terminated because those babies would not live. And to provide that safe delivery for the mother, and to unfortunately lose the life of those children who could have potentially made it in another condition, another environment, I think that's very, very difficult in the current times that we are seeing. I do want to kind of head a little bit into more positive light before I let Dr. El-Hinti speak, Dr. Jumana El-Hinti. I think that you highlight a lot of things that we do want to emphasize through PAMA. I think the mental health aspects for women and also for the healthcare workers are one of the areas that we are basically leading the way in Gaza. I think that the mental health is very, very important to the healing and the rebuilding. But currently, the current situation, we need to get safe healthcare access. We need to allow for safe entry. And I did see some of the chat questions, at least one that asked about politically, how can we help? I think the most important part for me is how can we continue to advocate for safe entry of not only healthcare workers, but healthcare supplies. We need to protect every healthcare institution. And that's one of our missions through PAMA, is the safe entry and access and progressing education and training for our people of Gaza that we are helping. It's beyond just a little bit of help. This is a project that will continue and will require rebuilding and restructuring. And we want to be committed to be at the forefront of collaborating with our teams and the people on the ground. I do want to bring up Dr. Jumana El-Hinti, who was also in Gaza very recently. She brings to us 18 years of experience as a clinician and as a neurologist in motor disorders and movement disorders. Dr. El-Hinti has been an advocate, a champion, the co-founder of PAMA in Toledo, where she currently resides and practices. And she's a mother and a very dedicated physician. And so, Dr. El-Hinti, would you please take over and share what you have with us?
Thank you. A co-founder of American Muslims for Palestine, not PAMA. I would like to share my screen, but you have to bear with me because my computer's not working. The camera is not working.
Mine did an emergency reboot today, which I still don't know why.
So just give me 1 second. It's the first time I do sharing on the phone. And so I'm having a little bit of here. Can you see my screen?
Yes, we can see your screen is being shared. Do you have the file? You just had it a moment ago, Dr. Jimena.
Right. You can see it now, right?
Yeah, we can see it now. Perfect.
Okay. So as you were speaking about the statistics and how there is 1 million people who have been displaced in Gaza, most of them are women and children. Most of the injuries are among women and children. Those are the recent statistics by the UN, and it's talking about how most of the injuries and the massacred people have been among women and children. Trying to move. Okay, so missing one slide. There were multiple aspects that I wanted to talk about. The first one is explosive injuries. So many women in Gaza have been injured in so many ways. I've seen multiple women with amputations, head injuries, paralysis. I've seen some with quadriplegia, paraplegia. So they've already, like, they're devastated for their lives. Burns are everywhere. Kids and women are devastated with burns, especially like really deep burns, and high percentages of their bodies are involved. They have disfigurement, nerve injuries. Those were actually, compared to the other injuries, might not be as bad, but they can affect their lives forever. So they have a lot of psychological implications on the women. So like those are the most severe cases, but what I wanted to emphasize more, if my slides move, where the other injuries, so they live in so many different areas, which has been really, it lacks any kind of normal, like, aspects of life, like normal life. So they live in tents, they live in those schools. I wanted to show this video where they're living in a classroom. So a school has probably tens of thousands of people in there. And I went with one of the nurses to where she is residing with her family, and this is how it looks. It's a classroom. And you see the wood up there, that what the mother sends her to gather every day. So cookies that she can sell. Her husband is in the north, and that's how we live. That tiny place is where they live. 10 of them. They sleep every night there. That classroom has 5 families. There are 100 people in that classroom who sleep every night. The nurse told me that their neighbor, like, there's a curtain separating them, and she has a little bit of dementia, and every day she falls on them in their room. And so, like, life like that is unbelievably hard. This nurse, like, the way she talks, and you can tell those people were like, they had a great life in the north. She's very confident, and she loves to take care of herself. And she's been devastated since moving to the south. They moved so many times, and when we talk about moving, it's not just like they're just like, when we want to move from one apartment or one house to another, it's so stressful. We get depressed sometimes, and it's a big deal. But for them, like Maggie was saying, within minutes, you'll get a phone call or you get a flyer or something, and then you have to leave. You have to make sure you got all the people in the house out. You have to make sure you got whatever is important for you. And most of the time, you can't even think what's important for you. I remember when we were there, we were told to have a backpack with the most important things that we have to leave with. So they told us within 5 minutes, we could be told that we have to evacuate, and you have to be ready. That backpack has everything that you need. And subhanAllah, I was thinking, what would be the most important thing for me at this point, and it would be just my papers, like my passport and stuff. And that tells you, like, we really don't need much in this life. But anyway, for them, like, you have to evacuate, you have to leave immediately within minutes, even sometimes seconds. And but you're leaving to nowhere. You don't even know where you're going. You don't even know if you have a tent, if you have a space to put a tent, if you'll have any of the normal the supplies of life. Like, are you going to have water or food or anything in that area where you're going to leave to? And this is all affecting those people mentally and psychologically and physically even. They are also exposed to injuries because of where they're living. So they're living among the rubble, they're living in tents, there's trash in so many places, a broken glass, sharp materials because of the bombs and stuff. And so they end up in the emergency room, although they might be healthier on the other side, but they end up with cuts and wounds everywhere, especially in their feet. And those, some of the cases we worked on, women just walking around, most of them are barefooted. And even if you have something on your feet, they're usually torn. And so they end up with those cuts and wounds. I remember one lady, the last day I was there, and I said, let's go to the ER in the morning before we went out of the hospital to go and see the devastation outside of the hospital. And she said that she started walking to the hospital, to the European hospital from where she is residing at 2 a.m. in the morning. She arrived at 6 a.m. just to get a cut wound in her arm fixed. And that's how much they suffer just to get some health care. They also end up with burns because they cook in the tents on wood, and sometimes somebody would move in a not an appropriate way and jerk that pot, like the pot or whatever, and they end up with burns. Those are all, for me, war injuries, because if they were living normal lives, they wouldn't have those injuries. And also we had cases where people would go back to their houses after living in tents forever. And as I will tell you how living in tents is so horrible in a minute, but they would try to go back to their semi-functional houses and try to clean them up. And when we arrived actually to Gaza the next day, we had 3 cases, a dad and his 2 daughters who were trying to clean their house. And they ended up with chemical pneumonitis. We don't know exactly what causes the pneumonia. And they were in the hospital the whole time we were there for 3 weeks. 2 of them improved and they were able to go to the wards, but one of them got a brain infection too, and finally died before we left. So there are so many things around that we are not even sure, those bombs, what kind of chemicals they have, what are those effects immediately, like acutely or chronically. And so sometimes you're dealing with the unknown. As I said, the environmental problems include the humanitarian crisis over there. And one of them that I want to highlight is the lack of food. When you don't have food, that is a major stress in your life. Because first of all, parents, especially women, especially that a lot of them, their husbands are still in the north, or they have been kidnapped, or they have been martyred. And so she's the head of the household now, and she needs to provide for the family. And so it's a major chore every day. Like I told you, that lady, we went to her tiny place in the classroom. That's what she does all day. She gathers the wood, and then she makes the dough for the cookies, and then she sells them. And I mean, I can't imagine spending your whole life just doing stuff like that every day. So this is a major stress for them. Another thing is that they're all malnourished. I've seen so many cases, especially with young women and lactating women with hypocalcemia. They have symptoms of neuropathy because of the malnutrition, lack of vitamins, stunted growth. Many of the kids there, especially girls, have stunted growth. Like you ask how old are you, and she says 14, and you look at her like she looks like an 8-year-old girl. They're all very thin, and you can tell that they have not eaten for so long. And this is actually exacerbation for the lack of proper nourishment that has been happening for years, because as we know that the siege on Gaza didn't allow people to eat more than a certain calorie count. Of course, when you are hungry, you can't sleep well, and that will also affect your overall condition, your brain function. You're always tired, and mood can lead to mood swings, especially in women. They can have hormonal changes also, and leading to mood swings because of the malnourishment. And when I was talking to some of my friends, one of them, a medical student, and his wife was telling me that actually just the act of cooking, just cooking is a chore, because we don't even have the tools to cook. So we have to borrow from other people and wait for them to finish, and we can like use their pots and pans and stuff to cook. And so even the tiniest, like every action, you have to think about every tiny step of that action. They don't have enough water to clean those pots and pans. And like Maggie was talking about how they have to cook on wood, but it's actually sometimes not wood. They said any trash, any rubbish they can find, paper, plastic, whatever, they will use it as a source of fire and then cook with it. And so they're inhaling whatever chemicals are coming out that's causing exacerbation of asthma. And now they're having other conditions. Whoever didn't have asthma now has asthma, or they're having pulmonary fibrosis from those chemicals. So many people are complaining of shortness of breath, wheezing, because of whatever they're using to cook for their families. And of course, the lack of clean water is a major stressful thing in their lives, because they wake up very early in the morning before Fajr to go stand in line to get clean water, to get the water they can drink. And then they have to stand for other lines to get the water they can use, the salty water they can use for cleaning and stuff. So there's so much waste of time and effort. They're frustrated. Now it's very hot. The heat is really bad, and they're getting dehydrated. And of course, with the lack of clean water, you have all the waterborne illnesses that are rampant nowadays, especially hepatitis A. Of course, there's lack of electricity in most of the areas in the hospital. In the European hospital, we did have electricity, but it would be cut off every now and then. When I first arrived, they told me count to 3 and it'll come back. But by the time just before we left, I would be counting to 30 and it doesn't come back after the closure of the Rafah crossing. They didn't have much gas to run those generators. And of course, lack of internet. And this is extremely important, because those people, as I said, most of them are separated. Some are in the north, some in the south, and in different areas. And so they depend on the internet to call each other to make sure that they're safe. And that adds to their stress when they can't communicate with others. And one of the very major problems, especially for people who are living in tents, is the lack of toilets. So I was told when I was there that for 100 tents, there's only 1 toilet. And those are usually makeshift toilets, like there's a hole in the ground and there's some plastic covering the area that gets, if it's windy, it will fly away. So there is lack of privacy. They do have in some areas more of a more sturdier toilets, but some of the girls were telling me, imagine you have to stand in line to go to the toilet, and then while you're in there, especially if she has her period, for example, and there are like thousands of people waiting outside and knocking on the door for you to finish and get out. Imagine how stressful that is, and in the face of not having any of the toiletries or the hygiene products that they need. this is extremely devastating. And one of the journalists there told me one night she had to use the bathroom. She was still in a tent, and she had to walk for a long time to get to that toilet. But all through the way to get to that toilet, she was followed by a quadcopter with the buzzing sound on top of her head. And they told us in Gaza, if you hear the noise, you're good, don't worry. But if you don't hear the noise, that's when you worry. And she said as soon as she entered that restroom, the noise of the quadcopter was gone. And so she got so scared that she didn't use the bathroom, and she ran back to her tent. She said that was it. I thought it was going to get killed that night. So those are the horrible situations they have to go through on daily basis. We went out to the tents behind the hospital, like a 5-minute walk, and I mean, those areas are just unbelievable. Like, I don't know how. Wallahi, I can't imagine, like, how can they survive in these conditions? There's no water, as I said. There's no electricity whatsoever. There's no internet, of course. There's you know, those are people who used to live decent lives. Some of them were really like accomplished people, and now they have to live in that tent, and sometimes accept goods and gifts from others and money. And I can't imagine how, like, they feel, how much inadequate they feel and humiliated. We visited one tent, and the lady there, she was so gracious, and she, like, I told her, you'll take whatever you want from what we brought, and she was like, no, you just give me whatever you think you want to give me. And then she said, no, please keep for others. Oh my God, it was like, I can see that she needs everything in that bag, but she wouldn't take much because she wanted to keep for others. So those are the beautiful people of Gaza, and I just really can't imagine how they're still doing it. I was on NPR one time, and I said, if one of us here in America get exposed to 0.1% of the people of Gaza are enduring every day, I'm sure that we would be in a mental health facility with a group of doctors holding our hands with multiple medications, because I don't think anybody can take what they're going through. The other part that I wanted to highlight was acute illnesses and exacerbation of chronic illnesses. And as Maggie was saying, they don't have actually their medications most of the time. And I've seen multiple cases in the ER with women who have not taken their blood pressure medicine for months, and they ended up in the ER with strokes, intracranial hemorrhage, and they actually don't get to the hospital immediately. Like here, within minutes, somebody starts slurring their speech, having one-sided weakness or whatever, like they're in the ER immediately. For them, it takes 2-3 days before they can come to the ER. And I've seen multiple cases like that. And so they've already, like, whatever you were able to do before, you're not, I mean, just supportive care now. When I was there, we were allowed to open a neurology clinic. So we ended up seeing many of the neurological cases there. And I've seen many women with multiple medical illnesses. So we saw movement disorders like Parkinson's disease, Lewy body dementia. We saw a very rare condition that early in my whole career, I only saw 2 cases. And then I saw one in Gaza. So I was just telling the student and the intern who worked with me in the clinic, like I was explaining neurological movement disorders to them. And I mentioned that case, I mean, that condition. And the next day, a lady shows up. She has that exact condition. And this is what we call orthostatic tremor, a tremor that happens in the lower extremities if you're standing. And as soon as you start walking, it goes away. Or if you sit down, it goes away. And you can see now, stands, how she shakes. So those are like those people, if they didn't know there was a neurologist, which there wasn't a neurologist in the whole hospital for a long time. There's one neurology or neurologist in Gaza that I know of, and Dr. Abu Muammar, he came and visited in the clinic, and he works mainly at Nasser Hospital, but he's, as you can imagine, he's always concerned about the safety of his family and to provide for his family. So he's not always there. But at the European hospital, there were no neurologists, and so all those patients with all these chronic or acute conditions, like we saw a patient with Guillain-Barré syndrome, that's an autoimmune disorder where you end up with ascending paralysis. And she presented to the ER and was admitted and went to the ICU actually and got intubated. And thankfully, we were able to, by the help of her husband, who was a doctor. And I was always thinking, if he wasn't a doctor, maybe we would not have been able to find the medicine for her, because he was a great advocate for her. And so he went to all the hospital. He tried his best to find the IVIG, which she received, and thankfully she did improve. And she was able to be discharged. But the problem is now chronically, she doesn't have any physical therapy. She doesn't have any support to help her to improve more and more. And I just pray for her that her family would help her with that. There are so many cases of back pain, neck pain, neuropathy, as I said, renal failure with all the neurological complications, dementia, and you see those patients like in the hallways of the European hospital, because people were taking refuge there. And I've seen a few cases of dementia, demented ladies with their caregivers trying their best to help them. One of them was cute. She's so tiny, she just bone and skin, and her daughter was trying to feed her and she didn't want to eat. So I gave her some candy and she was so happy that she didn't want to eat the food. She wanted to eat the candy. And she wanted tea too. I had tea, so I gave her my tea. A lot of cases of seizures, who had seizures before and they got exacerbated because of lack of medicine, or ended up with a head trauma and now they're having seizures. Multiple sclerosis and now they don't have their medications. And schizophrenia also, I've seen a few cases who are not taking their medicine anymore. Fibromyalgia, many cases. And the thing is, with the people in Gaza, they're so naive to medications. So when you give them like an antidepressant for the fibromyalgia, for example, one patient told me, oh, that medicine knocked me out. I was asleep the whole day, although I gave her a very low dose. But the thing is that if I want to prescribe medications, who's going to take care of the follow-up? Who's going to make sure they're not developing side effects? Who's going to take care of increasing the dose if they need that? And that was one of the the things that I was always thinking about. Should I start a medicine? Should I not in cases that I have the option of not starting a medicine, not of course seizures or anything like that. Also, we saw a lot of functional disorders. So those are like what we used to call psychogenic disorders. So manifestations of stress that end up with a neurological symptom. So like dystonia or a tremor or pseudo seizures. So they look like they're having seizures, but they're really just a psychogenic condition. The other part I wanted to talk about is mental health. And before I start talking, I wanted to emphasize one thing, is that the most common phrase you hear in Gaza is Alhamdulillah, all praise and thanks are to Allah. So they're going through so much, but the first thing they say when you ask them about anything is Alhamdulillah. And that was just amazing. That those people are some of the strongest people on earth. I say they're extremely resilient. They're unbelievably creative. And that's how they actually get some of their stress out. Yesterday, I'm actually currently in Columbus. I was at an art show where I featured some of the drawings of a young lady, 14-year-old Ritaj from the European hospital. And Alhamdulillah, we were able to auction them off and sell them for her. And she was ecstatic. Like, she couldn't believe that people are looking at her art. She said she feels like she's in prison, but just because her art is out, she feels free. And I mean, that's one of the ways they can cope with what they're going through. Another way is reading and reciting and memorizing Quran. I've seen so many kids early in the morning, they get their Quran and they are memorizing with their teachers, playing around, and drawing. Those are the main things they do. They are the most generous people I've ever seen in my life. They would share with you whatever they have. Even if they didn't have much, they will invite you for dinner all the time. And they are very resourceful. Anything that is around them, they will use it and make something with it. And they call them mountains. Those are the mountains of the world. But with all of that said, they are going through so much, women especially. As Maggie was saying, they lost so many family members. I mean, there's nobody I talked to there who has not lost somebody. Everybody lost a family member. They have been displaced so many times. And as I said, put yourself in their situation in 5 minutes, 5 seconds. In Al Mawasi yesterday, in Mawasi refugee camp, that's supposed to be a safe zone. When I was there, they were moving people from the European hospital to Al Mawasi. And yesterday they were, and it was, the whole area was invaded and they were forced to leave within seconds. So they didn't even take anything with them. That's just the clothes on them, and they ran away. And now imagine, where are they going to end up? And what are they doing? So this is all extremely stressful. And like Maggie said, it's especially stressful for the women, because we are always the ones who take care of everybody. And so their displacements are not just, it's not just a word. It has a multitude of effects on those people. Now, another stressful thing that they go through is not knowing where the rest of the family is. And I've talked to so many of the nurses who were displaced from the north to the south. Some of them were actually kidnapped and tortured, and finally released to the south. So they were kidnapped from like a Shifa hospital, and they had to walk all the way down to the south, and they did not know anything about their families, some of them for months. One of the nurses told me when he first heard his mom's voice, who he thought all his family was gone, he fainted actually. So this is like the norm for them, like especially the people who moved from the north to the south. And I've talked to so many of my friend nurses there who are engaged, and her fiance is in the north and she's in the south. And one of them actually yesterday, she was telling me how she feels so bad because she's extremely worried about her family who was with her in the south, because they had to move so many times, and the invasion is approaching. They're by the end of Rafah now. And she said, and she's also worried about her fiance, who was at a Shajaiya refugee camp in the north, where the same happened to them up there, just what happened to Al Mawasi. So like they have layers and layers of anxiety and worry and things to worry about. They all have plans and hopes. And I was talking to Bara, I mean, through her husband, who told me that actually she wrote me something, and she said that she has a 1.5-year-old son. And before the war, when she was pregnant with him, she had all those hopes and plans, what she's going to do with him and all that stuff. And then a few days before the war started, it was his birthday, and they were full of hope. And then now she's just worried, what is he going to wear? What am I going to feed him? He doesn't like to eat except fries. he doesn't like other stuff. And so now she's extremely worried about her son. She's not as worried about herself as worried about her son, and worried about her husband, who is a medical student, and he's not able to finish his studies, which was their dreams and his father's dream. So all these stressors in their lives. And actually, Nabil, the medical student, told me, and also our
Did we lose Dr. Jumana? Dr. Al-Hinti, are you still there? Okay. I think from what I could see, everybody can hear in her voice and in her passion, also everything that she's been through and that she got to see. Dr. Al-Hinti, are you still there? I think you're on mute. Can you unmute yourself?
I'm sorry, I don't know. I got disconnected. Let me share it.
We are near our time, I think, and I do want to open it up for questions if you want to finish up, I think, but I don't know if your screen can still come back up, if you want to work on that part of it, if you don't mind.
Sure.
Perfect.
And
I will silence myself for a moment while you do that.
so, yeah, I'm finishing up. so lack of privacy for the women also. They're always in their hijab and they don't even have that many clothes, and they're always in their prayer clothes the whole time. Lack of hygiene, like Maggie was talking about, and this has detrimental effects physically and psychologically. And the fact that they can't even take care of their beauty, that's also a very stressful thing for them. And then having to make decisions. Every 5 seconds, they have to make a decision. I've had a woman approach me when the Rafah crossing was closed, and she was crying and really devastated because she doesn't know. Does she move her family? Does she take them out of the European hospital? What does she do? And they face that question every day. What do we do today? What do we do? And so there were an array of mental health conditions that I witnessed over there, mainly anxiety, worrying the whole time, depression, postpartum depression, and they couldn't come to the hospital. So I heard of them somewhere outside where she gave birth at home, and she was suffering from postpartum depression. As I said, functional disorders and post-traumatic stress disorder, especially with all the atrocities that they had to witness. And so they didn't even have that many. I was talking to some of the healthcare workers there. They didn't have that many psychiatric clinics that existed before the war. And now there are no psychiatrists or mental health professionals at the European hospital. There's severe shortage of medications. Everyone is exhausted, and physically and mentally, so they can't really support each other, even like to help each other feel better. It's very hard because everybody is suffering. So medical missions are extremely important, and all specialties are needed, because we always hear that, you need surgeons, anesthesiologists. Yes, that's true. But we also need to take care of those people who are still alive and kicking and trying their best to survive. We need to help them. And thank you so much. I'll stop there.
Thank you, Dr. Jimena. You highlighted actually a lot of great points, and I know we're going to go over 2 o'clock if everybody can just hang tight for a little bit longer. I wanted to emphasize that. So yes, surgeons are needed. Yes, orthopedic surgeons and obstetricians and nurses and pharmacists and all healthcare workers are needed. But right now, we obviously work with the Ministry of Health. We are mostly working with the WHO, and the current most recent update that we are working on is we want to be at the forefront of leading the healthcare mission to support the mental health of the healthcare workers. You mentioned women don't have clean clothes. Unfortunately, the physicians don't have clean scrubs. Their families are living in tents and don't have clean access to clothing and food and water. There's so many aspects that we are needing to grow with. I think just for the sense to keep it concise and for the sake of time, I do want to highlight one last tidbit here. Are you guys able?
Hi, everybody. This is a voice
Here.
from Gaza. My name is Dr. Thalia Pahianakis. I'm an OB-GYN working in South Bend, Indiana.
Someone able to tell me a thumbs up if you heard it? Okay, so this is Dr. Thalia Pakianakis. I know I'm going to say her name wrong. She's Greek and she's amazing. She's from Indiana, and I've had the privilege of talking to her, but I just want you to hear some of the things she is saying before I wrap up my part and open for questions.
Let alone shower. There is no food. Everything is very expensive here. Patients are walking to come to the hospital since there's no transportation. Doctors are walking 1 hour to come to the hospital. It's very hot, 40 degrees Celsius, 104 degrees Fahrenheit. There is no escape from the heat. Patients are dehydrated since there's no water and the heat. Regarding the situation in the hospital, there is no soap even to wash our hands. It's hard to find. So in between patients, it's difficult to find a sink and soap to wash your hands. There are no gloves. There's no sanitation of beds between patients. In the operating room, there are flies at times. There are no drapes. Limited instruments, no gowns. They are even out of ultrasound gel. In the labor room, there is only one non-stress test monitor for monitoring the babies during labor. They used to have 6. Al-Nasser Hospital was invaded in February, and this is the hospital where they found the mass grave in April. So 2 months ago, there was nothing here, so they were able to, build a hospital in the last 2 months, but there's so much that is still needed to be done regarding sanitation and organization. However, medical supplies and aid is prevented from coming in, and you can see that since there's so much need in the hospital, even for basics like soap and drapes, gowns and gloves. So I know that for years there will continue to be a need here in Gaza. The people are suffering, people like you and me that had homes and basic necessities. So thank you for being here to listen to the voices from Gaza. Thank you. Bye.
I think I really wanted to play some of the segments she sent me. She was not able to join us. The internet connections are not very reliable right now in Gaza. And I think we have to highlight, a few summary points. We all are responsible socially and morally to contribute and to help. I think that whatever you do, you should advocate. We need to all be Googling and looking up who your current congressmen and elected officials are and advocating for the safe entry of healthcare supplies. It's not a lack of getting them. It's a matter of letting them enter into Gaza. I think we all need to advocate for the protection of healthcare facilities and healthcare workers. Out of over 36 sites, we only have 2 locations right now offering maternity healthcare services. And again, that's for obstetrical care. That's not to highlight the preventative healthcare, the primary care for women, the antenatal care and nutrition access, and importantly, the postpartum care and the depression and the anxiety, and then the losing the patients and the children of those mothers who are lost in childbirth, I think is very, very crucial. So we do have a lot of rebuilding. And I think what's really important to remember is PAMA was there before all this rebuilding needed to happen. Somebody mentioned type 1 diabetes in one of the questions I got in the chat. And one of the first projects of PAMA over 10 years ago was 7 dialysis machines to bring to Gaza. At Al-Shifa Hospital that you guys have seen in the videos, I'm sure, when you look it up, the destruction of Al-Shifa, unfortunately, and all the loss that we saw, a lot of the equipment still has the original PAMA stickers on it. So whatever you do, educate yourselves, and I think educate others and advocate for women who need us and who need safe and quality and humanitarian access to healthcare. One of the things that I will say is very important as we transition is not only the healthcare access to mental health for the workers, but we in PAMA are going to be focusing on the heme-onc aspect as well. Think of all the cancer that's not being detected, and importantly, all the cancer that's not being treated currently with the crisis ongoing, whether it's breast cancer, female health cancers, or all the other oncology aspects of healthcare. We're also focusing not only on that and surgery, but primary care. And there's going to be medical points that we will be a part of. These medical points will access for primary care. And again, we're going to include women at the forefront of that primary care to help ensure their wellness and their preventative and preconception counseling, but then also postnatally conception counseling, nutrition and health, and those chronic conditions like diabetes and hypertension that we can work with. I think that's going to be really essential as we work with our collaborating groups to help ensure that. And we will be there to rebuild. We've been there in the past, and we will continue to advocate and send. A lot of the questions I got to focused on access. Right now, unfortunately, there's only access through Karm Abu Salim, which is one of the borders since Rafah was closed. And there are restrictions on ethnicity. So not all people who want to volunteer can volunteer currently, unfortunately. And it used to be 2-week missions. So PAMA last year sent over 8 mission groups, and we had subspecialists going, and we had all kinds of healthcare missions to Palestine and Gaza and the West Bank. But post the war and during this war, since January, we had sent at least 5 teams. We were committed to sending 2-week delegations of specialists per the need that was advocated to us from the people on the ground. And unfortunately, most recently, we were not allowed in with all of our members, and also not all of the medical equipment nor supplies. So those teams need to be able to enter. The supplies that we are providing for the people who need them the most, we need to advocate to let enter through. And so I did share the link in one of the questions that was raised as to how you can volunteer and sign up. And then when your services and help are needed, we will be able to call on those who are needed the most. let me look at these questions if you guys don't mind in real time. Does PAMA work with Gaza Health telehealth care? Currently, I believe we are not working with the Gaza Health telehealth care system. Mostly we've been doing mission work on the ground with just real live human access and care. But that is something that I will raise to the board to ensure that we continue to work in every aspect that we can. Obviously, our mission is to continue to be at the forefront, and we are a very reputable organization that will work with these groups. I think one of my team members might be answering. Maggie is going to answer. Have any medical mission members given testimony to the ICC about the war crimes witnessed? So I really was hoping today to focus more on our humanitarian efforts. Obviously, I don't want to ever undermine the suffering of anyone or any of our people back home in Gaza or the West Bank. But as far as I know, none of our PAMA members, however, we have had a lot of PAMA members advocate in Washington, D.C., and currently advocate through our American government to meet with many members of Congress and with our president and to try to advocate for safe entry and protection of healthcare workers. When you send monetary donations, which organizations receive it, and how do you ensure that it reaches Gaza? So the beauty is that we have been established in Gaza for over a decade now, and we have people on the ground. And so even during Ramadan, when teams were not being allowed in, we were able to be at the forefront of feeding families, thousands of people in Gaza. During Eid al-Adha, which was the most recent Muslim holiday, we were able to send food and sacrifice lambs and do all the things to ensure nutrition for as many healthcare workers as we could. And so those are going straight through the team, through PAMA, to the people of Gaza who need them the most, because we've already had established team members and programs on the ground. And it is, like I said, a 501c non-for-profit American-based organization. How can you volunteer as an undergrad student, and are supplies packaged here and sent to Palestine? So volunteering can be anyone, whether you just want to go on our website and click on the link to volunteer, to be a member, to for free access all the information and advocate and help bring chapters to your local area. Anyone can volunteer. In terms of mission work right now, we are only taking experienced attending physicians and nurses and healthcare workers in practice of all kinds. We've never sent a team that was not a full team. We like to send nursing, pharmacy, medical and surgical physician specialties that are needed. But at this time, no medical trainees are being sent, only attending physicians due to the restriction. But we hope that that will change in the very near future. We were sending supplies that we were packaging. So for example, the May mission, I believe, took with them almost 300 suitcases in their team delegation. And that was able to enter Gaza with sutures and medications and essential supplies. Unfortunately, the most recent team, however, through Karim Abu Salim, was restricted, and the current rules of engagement only allow 2 suitcases per member of the team, and they are not able to bring in medical supplies. And so a lot of times we do purchase things locally closer to Gaza in the Middle East. The problem is letting those in. Unfortunately, has not been an easy task in the last few weeks. And the delegations are now having to commit to 4 weeks instead of 2. These were all newer rules that changed recently. Has the European hospital been targeted by Israel? So I don't really want to go again into politics. I think my biggest thing from today is I want to go into advocacy and what we all can do and should be doing. But I will say all the hospitals of Gaza, unfortunately, have been targeted. There is no safe, normal hospital environment anywhere. Tents and makeshift locations are being built. Hospitals are being rebuilt in some cases, like Al Nasser Hospital that was shared in one of our speakers' testimonies. But unfortunately, our European hospital, of course, is not functioning at full capacity like it used to. Currently, there's one CT scan machine that is not fully functional, I would say. There are many limitations in the access to the tools that we have, and the OR suites and the medications and the sanitary process. I mean, everything, unfortunately, is not quite at a level that we would find acceptable anywhere else in the world. And so I would say there's more work to be done. This is not only a project of now, but a project of moving forward. And that's where we need advocacy and funds and commitment, but also we do need more manpower and woman power to help all of those in need. So I think that should answer all the questions, I
If
believe.
I add, Maram,
Yeah, go ahead.
we need doctors and healthcare workers to go in, and we also need to put pressure on the Congress and White House to get more people evacuated for medical care. So in the past few weeks, there has been some pressure, and finally, a couple of days ago, they started getting some people out. But after the closure of the Rafah crossing, nobody was allowed to go out, and there are at least 14,000 people who need to get out for immediate medical care. Some of them have already died because they couldn't. And I wanted to mention that calling your representatives, meeting with them personally, going to DC, doing whatever, writing letters, all this does help. It does work, especially in those, because they want to show that they are doing something. And so these cases are something that they can do. Like they can talk to, put pressure on the Israeli embassy and the government of Israel. And we've seen the effect that people have been evacuated. So please don't underestimate any action that you can do.
Sorry, I was on mute for a moment. Someone asked about volunteering. So we will continue to take volunteers through the forums. We will forever need healthcare workers. Currently, the question was about being a Palestinian American volunteer. Unfortunately, with the current restrictions, those of us who are Palestinian born or the offspring of Palestinian born people, even if we are American, are currently being rejected from entry into Gaza. And so I think in an effort to continue to advocate, we need to also maybe advocate for access for healthcare workers to enter. But I think that's secondary to just letting anyone who is able to enter right now safely enter and practice medicine and improve the disaster and the catastrophic care that we have right now. But if you are a Palestinian American, it's still very restricted and very, very likely that you will get rejected from entry at the border. And so those of us who are Palestinian are not really being allowed in. But again, we have many colleagues, thankfully, of all origins that are willing to and able to help, and we need to continue to advocate for that. How can medical deprivation be allowed? How is the WHO intervening on this issue? And what have they done so far? It hurts to know that this happens. It hurts a lot, unfortunately, for all of us. Actually, 3 of our board members recently tried entry into Gaza and were denied entry, even though they have gone on many medical missions from the beginning of the organization and prior. And so we are collaborating with the WHO and with all of our partners medically and globally, but we are very much humanitarian focused, and we are a team that wants to ensure access and progression of healthcare and education for the medical students and trainees and the women and children and all the people and men of Gaza as well. And so we have to comply by the rules. We are very transparent. In fact, that's one of the things that I think makes PAMA as special as we are, is transparency, and equity in healthcare are some of our passions and what we are known for. But we are working with the WHO. Unfortunately, a lot of these things are beyond our control. Can medical deprivation be allowed? I think I already kind of answered that question. Is there any other questions? Does anyone want to raise their hand, or is there anything else that any of our panelists want to contribute? I apologize that we have gone over our time slightly. Well, thank you everyone for your time today. Thank you to our volunteers who have been to Gaza. Hold on, I think I just saw something pop up. Thank you so much. When will the next mission be? Since January, we were planning and committing to send a mission every 2 weeks, and in fact had sent reliably 5 full missions. And the most recent one was a smaller team that was let in through Kerem Abu Salim. Unfortunately, I'm not sure when the next mission will be. Again, we are taking volunteers nonstop, and Dr. Majdi who's he's the chairman of PAMA, one of our volunteers who tried most recently to enter, is working very closely with our team to help advocate. And the most recent news that I was given up until this week is our focus currently is going to be surgical care, hematology, oncology, and then mental health. These are the 3 newest areas of focus. We will be partaking also, I know I'm working with the GEMS project with a few of our board members to help advocate for medical education for the medical students of Gaza, who unfortunately have had, they've lost many of their attending physicians and they've lost a lot of their educational infrastructure. So we're trying to help continue their educational progression so they can graduate from their medical schools as best we can. And we are trying in every aspect of education and disaster and mission work right now to help with improving access and rehab. I believe those were all the questions that I see that needed to be answered. And if I can just wrap it up with, please let this just be the beginning of a collaborative discussion. Let this be the beginning of maybe your mission to help others who are in need, to advocate for those who maybe don't have the sanitary and basic human rights and access that the rest of us are very privileged to have. And it does make a difference. What we say, what we do, our responsibility to those in need, I think, is very, very global. And to think of the women's healthcare disaster and the mothers suffering, and even the girls who are amputated and having menstrual problems, and the lack of access to education and clean water and healthcare and just human dignity. I think if that doesn't resonate, then I hope that the responsibility of just, justice and equity and healthcare rights for all does. If there's anything that any of you have questions about, please reach out to us. I feel like I know it's a busy Sunday for most of us, and I pray that no matter where you came from today, that you were able to benefit a little bit from the current situation. And I encourage you to go to our website through PAMA and simply sign up to be a member if at all. That will maybe open your eyes and allow you to share some of your work and your commitment and your own passion. So thank you, everyone. And thank you to our speakers. I appreciate you all today.
Thank you.
Salam.
Thank you.
Thanks, Maggie.